Our second presentation is representing FIU, and we have Rachel Reese, Uriela Adain, Alejandro Maulini, and Claudia Calvo. And if I didn't say your name correctly, please correct me as you introduce yourself. Adine?
Okay, good morning, ladies and gentlemen. We are the Florida International University Young Cubans for Change team. Today we will be presenting the healthcare infrastructure in Cuba. Our group, as he previously mentioned, is composed of Rachel Ruiz, Uriel Adine, Alejandro Maulini, and myself, Claudia Calvo. This project is very personal to us because we are all originally from Cuba. We were born there. And
civil engineering majors.
we are civil engineering. Our major is civil engineering. We are all seniors at Florida International University seeking our Bachelor's of Science in Civil Engineering there.
So, as the song says, ¿Qué culpa tengo yo de haber nacido en Cuba? Right?
Exactly.
So, if you're ready, Alice will start the clock, and then she'll give you a 2-minute warning.
Okay.
Thank you so much.
Thank you. Okay. In today's presentation, we will cover a brief history of the Cuban healthcare system, the costs and revenues that keep the system afloat, and we will compare and contrast the hospitals for locals to those that the tourists and the government officials attend. And finally, we will end the presentation with a proposal in case that there is an immediate transition in the government. Okay, to start off with the history of the Cuban healthcare system. After the 1959 revolution, when Castro takes power, many of the doctors in the island fled because of different political views. This resulted in a demand for doctors in the island. So what the government does, the new government starts building new medical schools, as well as hospitals and a new system of polyclinics all around the island, even through the rural areas in the island, in order to encourage new generations to pursue a career in the medical field and seize the demand for doctors in the island. Now, when in the following years, there's a surplus as a result of doctors in the island, and the government sends a group of doctors abroad to help out other third world countries in Latin America as well as in Africa. Because they were doing such a good job outside of the country, UNICEF declares Cuba to have an ideal healthcare system in the decade of the 80s. Now, all throughout, the Soviet Union had been subsidizing Cuba since the 60s, all the way through the 90s, in all aspects. As a result, in the 90s, when the Soviet Union ceases to aid Cuba, the community faces what is called the special period, which are harsher times in the island and lack of resources. Statistics show declining values in the economy, as well as the money for medical equipment, the caloric intake of the average Cuban. And something that we wanted to depict is that statistics also show that the mortality rate dropped, while it doesn't really, it's very ironic. You could tell right there that it's been altered somewhat, or at least it doesn't make much sense that all the declining values also depict a declining value in mortality rate. In this presentation, we hope to capture the difference, the gap that there is for the hospitals that the regular Cuban attends to that the government officials and tourists attend. With that said, I'm going to hand it over to Rachel, who's going to talk to you about the cost and revenues that keep the system afloat.
Okay, so most of the expenditures today in the healthcare system are covered by the Cuban government, and however, it's important to note that there is a portion of these expenditures that are covered by private companies, and it has actually been reported that 92% of the healthcare expenditures have been covered by the Cuban government between the year 1995 and 2009. And the other 8% was covered by private companies. Now, these expenditures have been increasing over time, and as you can see in this graph, which depicts the total expenditures of healthcare as a percentage of GDP, in the year 1995, the healthcare expenditure as a percentage of GDP was 5.7%, and this percentage increased to 11.3%. This is actually not a good thing, because for the so-called ideal system that the UNICEF said Cuba has, simply because an ideal system has to be cost-efficient while providing a good healthcare service. And obviously, this is not the case in Cuba. And Cuba right now is receiving a lot of donations and revenues. Many people say that because of the embargo, the healthcare system was affected. However, it has been reported by the United States that that they never stopped helping Cuba. It has been reported that 36 companies right now are working on Cuba, have been approved to work in Cuba and provide service to the Cuban government. And it was reported that between the year 1993 and 1997, Cuba received $27 million in donations from the United States. Now, the healthcare system has become a huge business in Cuba. There are three types of businesses inside the healthcare sector, and they are the health tourism, exportation of doctors, and the exportation and development of biotechnology. Now, in the health tourism, right now there are 52 hospitals dedicated partially or completely to offering service to tourists. And right now it has been reported that 20,000 tourists are receiving medical service in Cuba. And this business is actually generating $40 million annually. Now, on the exportation of doctors, the business became known and important in the year 2004 when Cuba signed a contract with Venezuela, in which Venezuela guaranteed Cuba 90,000 barrels of oil daily, and that was as long as Cuba provided medical service to Venezuelans. And this business has increased the annual revenues that Cuba is receiving. In the year 2003, the annual revenue was reported to be $2.8 billion, and this revenue increased to 8.6 in the year 2008. Right now, there are 70,000 Cubans, doctors, working right now outside the country, and we say that these are slave doctors simply because they're receiving, the money that they're receiving is $600 monthly, and this is actually, like this amount of money, it's not enough for a doctor that has a lot of experience, and out of this $600, $200 they have to use it to pay for food and other things for their daily lives. And on the development of biotechnology, in the 1980s, Cuba invested a lot of money on developing centers to create new biotechnology. And actually, right now, Cuba developed the hepatitis B vaccine, and this vaccine is being exported to 30 countries and is generating a total revenue of $300 million. Now, Uriel is going to talk about a brief history about the Cuban government.
In order to illustrate the current condition of the hospital used by locals in the island, we focus our research in two main hospitals, Hijas de Galicia and Clínico Quirúrgico 26, both located in the capital. Hijas de Galicia is a hospital that is located in Luriano, Havana, and was created in 1912 when a group of women from Galicia opened this hospital for those 60,000 who immigrated from Spain in the first decade of the 20th century and ended up working in the street. I ended up in the street and working as a servant and didn't have the the possibility to pay for those medical services. Originally, this hospital have a capacity for 206 patients hospitalized daily in an 8-floor building with 5 operating rooms. Here you can see a front view of the building in the actuality, and another of the lobby. In the actuality, the general conditions are really poor and unfortunate. This picture right here we're taking inside one of the rooms, bathroom. As you can see, besides the unsanitary conditions, you can find unsafe electrical utilities. This is a short video of one of the rooms of this hospital. You can see a broken door. You can see the switcher without cover, no sink. The walls are really, really dirty. I mean, it's really unsanitary. This is an average room in any hospital in Cuba, in the capital. I don't wanna think about the interior of the country. There's no window. The winter night might be really freezing there. I don't know how that day was running water, because that's not a regular case. I mean, it's really hard for a woman who just gave birth have a shower there. It might be really hard. The next hospital is Clínico Hugo 26. This hospital is located in the actual center of Havana. You can see here the Videro of Paulina. Was finished in 1957 under the name of Mercedes del Puerto, mother of the mayor at that time, at that moment. In 1959 was changed to Joaquín Albarrán, but everybody know it as Clínico Hugo de 26 for being located in the 26th Avenue. Originally was a 5-star building, a 5-star hospital equipped with the latest technology of that time. The main floor was covered with marble, the rest of the floor was covered with granite. There were 14 wards. Also, this hospital had an excellent laundry service. However, these machines are no longer functioning. And for this reason, patients staying on that building that was constructed in the year 1989 to expand the hospital have to wash and hang their clothes in the building balcony and window. And now these are more pictures of the hospital. You can see the first aid room, broken ceilings, more pictures of the same conditions. This is a different hospital, a different bathroom, is the same. Laboratories, I don't think any tests, they come from there. And the panels and the boxes are completely open and unsafe. And now Rachel is gonna talk a little bit about the hospital used for tourists.
While Cubans in the island are receiving medical service under inhumane conditions, tourists are actually receiving, tourists and government officials are receiving very inexpensive and good quality medical services in 5-star facilities. Now these facilities, they offer a variety of services, including joint replacement, cancer treatment, eye surgery, among others. And an example of the facilities that are actually used for tourists and government official is the Cida Garcia Hospital. And as you can see on this video, unlike the other 2 hospitals Uriel talked about, the Cida Garcia Hospital has very comfortable beds. They could be adjusted. Bathrooms are in great condition. They have running water. They have on the rooms, they have TV, safe. They have telephones that they could use to contact the doctors or nurses if they need to. As you can see, also the kitchens, the hospital has a kitchen, and they serve daily food, and the patients have the option of eating there, and they don't have to ask their relatives to bring their food or cook them. Also, the relatives that are visiting have the option of eating in the cafeterias that they have there, or they could also use room service, which the regular Cuban does not have that option. And also, as you can see, they have a laundry service. They have a daily laundry service. Unlike the Cubans, they don't have to worry about washing their clothes and hanging their clothes on balconies and windows just to get them dried. They have an excellent transportation system for intensive and regular care. Now, Claudia is going to keep going about talking about the proposal in case of a transition.
Okay, in case that there is an immediate transition in the government of Cuba, we propose that we make the system better by implementing a hybrid system and restructuring the existing system facilities, the arrangement of the facilities. What do we mean by a hybrid system? What we mean by this is that we implement public services as well as private services. In the private services, we would incorporate aesthetic procedures, plastics, etc., which is more of a luxury to patients. The government wouldn't be responsible for paying this. This is fully the patient's responsibility to pay for the cost. In the public services, it would be any critical procedure, life or death. That way, every person, every common individual in the island could, even though they don't have the means, could still have the procedure done. That would be in the public services. And the way the government would subsidize the procedures would be using the existing business that they have, the existing healthcare business. We mean by this, we mean the tourism, the medical tourism, as well as the exportations of that they receive, the money they receive from exports. With that said, I'm gonna hand it over to Rachel, who's gonna talk to you about the restructuring of the facilities.
The existing structure of the medical service right now in Cuba, it's first I'm going to talk about the goals of restructuring the system. Our first goal is to improve the existing healthcare conditions of the